Hello and welcome to today's webinar, Engaging the Member in Ways That Matter. Before we get started, I'd like to announce a few brief housekeeping details. Today's session is being recorded and an online archive of today's event will be available a few days after the call. You will receive an email from AHIP that will ask if you would like to receive the archive. Please respond to the email if you would. I'd like to remind you of AHIP's antitrust statement and ask that you reference it in the Handouts tab. The antitrust statement prohibits us from discussing competitively sensitive information. Please keep in mind you may ask a question at any time during the presentation by typing your question into the chat box located in the lower left-hand corner of your screen and then click Send. You can adjust the size of the slides to fit your screen by clicking on the Scale button located in the upper right-hand side of your screen. We're very fortunate to have with us today Rick Ingram, Director of Vertical Markets at LexisNexis Healthcare. Rick, a leader in health industry insight and analytics, leverages his 32-plus years to enable team effectiveness in business development, strategy, business intelligence, and performance management, marketing, entrepreneurial planning, communication, training, and thought leadership. An accomplished public speaker and proven executive relationship builder, he presents senior management experience in the healthcare, insurance, analytics, software, and regulatory industries. Cathy Bardeen is Director of Product Management at LexisNexis with responsibility for product delivery and support for the Healthcare Identity Data Intelligence Suite. In her role, she works closely with data scientists and data acquisition teams to identify optimal use of public records information and healthcare claims data for the purpose of identity authentication and proofing, as well as improving the quality of patient-member demographic profiles. Cathy has a bachelor's degree in science from Michigan State University. At this time, I'd like to turn the floor over to Rick.
Thank you, Catherine, and welcome everyone. I hope you'll find today's content informative and helpful, but perhaps more importantly, thought-provoking. Both Cathy and I are committed to empowering the healthcare community with approaches that both support improved effectiveness but also nurture innovation. We hope that today's somewhat one-way dialogue might lay the groundwork for continued conversations, and our direct contact information will be provided at the end of today's session. Now, those of you that know me well know that I rarely pass up on any opportunity I have to hear Atul Gawande speak. This public health researcher, surgeon at Boston Brigham and Women's Hospital, and TED Talker never disappoints me. Providing health care is like building a house. The task requires experts, expensive equipment, and materials, and a huge amount of coordination. Experts, expensive equipment, materials, and coordination. I'd like to think that Atul would agree that this holds true across all members of the healthcare ecosystem, and certainly for the health payer sector. In fact, these complexities speak to the journey many of us have experienced as we went from working within insurance and its long-defined operational processes to a health plan setting where paying claims for covered benefits must often be overshadowed by care management and member engagement programs at a minimum. The art of relationships and coordination are disciplines that are critical in today's setting. As a health plan in 2016, intersections with critical players in the business model are multidimensional in both their role and impact to the healthcare's bottom line. For its members, they increasingly fill the customer role, either in the individual market or now within the employer group market in an increasing partnership dimension with their own employer. This means that many of the key ingredients or demands of consumerism can be expected to only increase, particularly convenience of access, performance, price, satisfaction, and quality. But their behavior as patients, consumers of the healthcare system, in how they adhere to areas like physician directives, utilize points of service, and work to align life choices that impact their health ultimately drive success or failure across nearly every function of the health plan. For its providers, the primary role of care deliverer will likely never be diminished, and the degree to which evidence-based medicine is followed and, likewise, the plan's medical policy of appropriateness similarly following such evidence directly impacts cost of care and often outcomes. As plans spread across new geographic regions, the provider is a supplier and is critical to the benefit plan's perceived value to the member, but equally important to the in-network capabilities of a plan design. Now add care delivery and payment models, and the relationship between plan and provider must be constantly nurtured. Add to it the mix of federal, state, and county regulatory bodies and market channels, either via public or private insurance exchanges or the broker community. Well, relationships drive every operational point of a health plan, and coordination of information, insight, and communication is increasingly critical. Plans can no longer allow operationally siloed departments, and I would argue we must think increasingly of each of these touch points differently. The elephant in the room may well be, do you have the information sources to support this change? Good quality is less quality because of more accurate diagnosis, fewer treatment errors, lower complication rates, faster recovery, less invasive treatment, and the minimization of the need for treatment. More broadly, better health is less expensive than illness. Professor Michael Porter at the Harvard Business School submitted this assertion in his research published by the New England Journal of Medicine in July of 2009. Heady stuff indeed. But I can't help but think about the journey we've taken these past 7 years and whether we were actually more prepared to truly achieve the state of better health being less expensive. Still, with the emergence of value-based payment models and care delivery models like ACOs and patient-centered medical homes, along with the recent macro benchmarks for quality, cost, clinical practice improvement, and advancing care information, Dr. Porter's concept is increasingly becoming positioned to be realized. So where has the health plan community been focusing its efforts? Well, it's been a world of balancing. Much effort has been on understanding effectiveness throughout the study of the relationships between or trade-offs within areas like cost versus quality, and benefits design versus cost incentives, outcomes versus provider treatment practices, and in and out of network costs. The effectiveness of these studies also have to be balanced with the study of efficiencies as we delve into understanding areas such as business mix and margin management, medical loss ratios and health programs, population health and condition stratification, provider performance and provider collaboration. Still, these seemingly never-ending analytic exercises pale in comparison to the coordinated efforts required to achieve the triple aim of improved health, improved patient experience, and lower cost per capita. Why? Because it's more than analytics required. It's the ability to, one, understand a higher level of interdependencies, and two, based upon that understanding, change processes to achieve the optimal balance. These interdependencies are more than balances. Some have even referred to them as three-legged stools, as their relationships are more causal and with little room for variance without penalty. Many of these relationships encompass understanding the marriages around areas like care coordination to adherence to outcomes, or quality to readmissions to costs. I think of care programs as being related to marketing effectiveness and then to medical loss ratios. I think of member education to networks to fraud, waste, and abuse prevention. Certainly member insight is linked to retention and to acquisition. And location is related to network practices and to outcomes. Yes, indeed, this isn't your grandmother's insurance company. In fact, every study across the health plan organization is complicated in nature and requires a new way of thinking and solving problems. These studies are not for the faint of heart. The challenge often is to attack them in ways not yet embraced. Collaboration within the health ecosystem has always been a spoken objective, though we at times seem to be without the mindset or skills honed to lead and assist. Perhaps understanding the playing field might help. Let me quickly share a story from my past. Years ago, I was speaking at HFMA's annual gathering on tools to enhance collaboration between plans and providers. Now, to be thorough, I decided to look up the definition of collaboration, though I thought I knew it, and I've looked at it differently ever since. The full definition surprised me. It read, to work jointly with others or together, especially in an intellectual endeavor, to cooperate with or willingly assist an enemy of one's country, and especially an occupying force. Now, the trick is to recognize the adversarial relationship without sacrificing the opportunities to learn from each other and share information. Sharing is leading. When we can jointly and continuously emphasize this, collaboration becomes attainable. So what does all this mean? I would submit that the challenges of coordination of care apply to all processes within the health plan, and that coordination requires doing things in concert differently while consistently focusing on why differences can bring about new insight. Does your team have the commitment to walk the talk and walk the coordination talk? If the individuality of your member and your physicians and the family caregivers are important, why not make them the absolute bedrock of all effectiveness, efficiency, and relational efforts? It would seem that if, as Professor Porter asserted, good quality is less costly and better health is less expensive than illness, it would be logical to focus on individual-centric methods. As it stands today, it seems that these things have been somewhat marginalized. Could it be because we keep performing similar exercises over and over and still struggle with all too familiar and predictable results? Well, we all know what is said about doing the same thing over and over and expecting different results. Let me suggest a different point of view around results desired and what to leverage and what to do. Commonly, I think we all are always looking to lower and balance appropriate costs and to reach lower and right utilizations of the medical system and improve communication with providers. These are certainly desirable results. But what if we were more focused on members being more engaged in their health, their plan, and their provider? How would that change what we would do and what we would leverage? Traditionally, when we seek to solve these problems, we look around claims submitted and remitted and provider performance history. Some organizations rely strictly on core data for underwriting, enrollment, claims adjudication, and explanation of benefits generation. But what if we were to take augmented owned data for patient engagement, process enhancement, and consumerism? We would perhaps move away from the templated standard letters and the EOB accuracy forms and the procedure authorizations and find ourselves looking more directly for increased personalized member. So how do we achieve this new norm of focusing on individual focus? We're proud to be delivering healthcare solutions across a variety of spectrums of hospitals and retail pharmacies and PBMs and life science organizations and nearly 700 of the nation's insurers. Augmenting their own internal data with external sources, health professionals can achieve new age additional insight and analysis to address literally every concern of the industry. Critical to your success is our technical experience and vast data assets. Cathy would like to briefly take you through this. Cathy?
Thanks, Rick, and good afternoon, everyone. LexisNexis is in a unique position to assist in the key themes Rick has mentioned today. He stressed the importance of balancing both effectiveness and efficiency and the evolving relationships between all the key stakeholders in the healthcare continuum. He discussed how it's critical to focus on both coordination and personalization of relationships between a health plan, a provider, a caregiver, and the members, or really the consumers of healthcare. So I feel that there are three key pillars that are critical to success of delivering solutions to address this complex environment of which many of you find yourself in today. Connections, technology, and impact. At the core of all of LexisNexis offerings is our data. We aggregate diverse data sets on individuals, providers, businesses, and facilities, and we understand the relationships amongst those complex entities. This is a combination of public records, claims data, and proprietary data sources that contribute to the ability to understand an entity, a person or a facility, a business, and the many complex attributes that create those identities. It's not just enough to amass large amounts of data without understanding the intersections of this data and the connections. The connections between an individual and the world around them is key. And that world could be as basic as an address history, a current phone number or email, to even Leveraging something more complex is understanding the identity's social network, their relatives, their neighbors, their associates, maybe their business associations, or their connectivity at arm's length or further to other organizations. Now it's great, although LexisNexis is committed to the quality and accuracy of our referential database of information, all of this data can't deliver on its own or independently. So it's critical and crucial to have a platform, which we refer to as our HPCC, or High Performing Computing Cluster, as well as intelligence and analytics on this data and information in order to be able to deliver solutions effectively. Again, amassing records on Cathy Bardeen as to where she lives, maybe the assets she owns, and her college credentials is interesting, but it's truly useless unless I can connect the dots and understand that Cathy Sandell in East Lansing, Michigan, as a renter, is the same entity and individual that we now see as Cathy Bardeen as a homeowner in Florida. So really, the ability to link together and draw those associations is critical. And to have a platform that can handle such large amounts of data and deliver sub-seconds solutions and answers to very complex problems is critical. So ultimately, it's the union of both the ability to make the connections between identities, businesses, individuals, providers, and with our vast data repository, also the platform that allows us to bring insights and intelligence onto that data that situates LexisNexis in this unique position to deliver impactful solutions, and as Rick mentioned earlier, really empower our healthcare community. I'm going to take a deeper dive on some of our data and our ability to better create connections across unique data sources and give you some insight into the information. As Rick mentioned, a lot of this data may be outside of what is traditionally captured from a health plan. For example, it can be critical in effectiveness and creating engagement, but maybe not something that's necessarily being captured today. People are complex and everyone has their own unique path. So LexisNexis focuses on acquiring data to give us that comprehensive view of both individuals and businesses. So let's take in healthcare specifically, for example. We'd be capturing the basic provider unique information, such as maybe a DEA number for prescriptions, professional license information across all 50 states. Using this information in conjunction with information around disciplinary sanctions, hospital associations, board certifications, really allows LexisNexis to create a profile or an envelope of information on a provider to be well suited to answer questions, customize or optimize information about that individual, and deliver solutions. However, our efforts don't stop there. We also focus our data acquisition efforts on other interesting data and attributes, such as, let's say, asset information like home ownership or vehicle information. We also broaden our scope into derogatory information because understanding the full complexity of an individual sometimes will be taking into account some of the more challenging aspects of life as well. So for example, a bankruptcy or possibly a felony conviction, unfortunately. So finally, we also focus on some more diverse areas because, again, as I mentioned earlier, not everyone has the same path in life. So we kind of term these individuals who don't necessarily get a car loan or don't get a credit card right away as what we consider the unbanked. So because, again, we want to be able to bring solutions to the broad spectrum of society, we need to be able to have data, assets, and identity information on the broader population. So by incorporating this information, it allows us, again, for the broad spectrum of individuals, either credit-bearing, not credit-bearing, public records thin as they're younger, just entering into the coming-of-age period of time, to be able to create solutions that can address answers for that entire population. So as I indicated, identity data is understanding the personalized view of an individual, and LexisNexis really focuses on the data acquisition and the ability to capture that information so we can help create and drive effective solutions and insights. With that, the great news is that with all of this data comes great responsibility, and LexisNexis shoulders that responsibility as we ensure the solutions we deliver accommodate all the regulations, the security controls around both access as well as delivery of this data and information. The responsibility to protect information is taken very seriously at Lexis, and we mandate that our data is leveraged with all the appropriate permissible purposes and security protocols. This is executed both internally as well as externally when we deliver any product solutions to our clients. Data security and policing of this information is our #1 priority. Trust me, I take about 15 different trainings and certifications a year on this topic. So with that, I'm going to turn it back over to Rick so he can discuss more specifically information around our socioeconomic health attributes.
Thanks, Cathy. Now, you may or may not be familiar with the term socioeconomic health attributes or social determinants of health. In fact, I just came back from Washington, D.C. for a week conference, and there were many definitions floating around the conference hall. Because these attributes are not derived from data sources traditionally captured nor consistently validated within the normal operational processes of a health plan, a valuable gateway to individualized insight into a member, their family, or their caregiver may be missed. When we think about those things that impact a member's life, the ability to clinically validate a correlation between a life event and, for example, stress, and the ability to derive that information over a period of time dating back over 35 years often can give an initial clinician an insight into what their patient may be presenting before ever really going through a full evaluation. As health plans deal with new memberships coming on board without any clinical data to look at, it's critical that we be able to start leveraging data that is publicly available that may be indicators. We all know and all get excited for individuals or friends of ours when they get a massive job increase or they buy a new home or they see an increase in their income. But the realities are those good things also present stress factors almost equally as the events that we traditionally see as bad. So the ability to be able to consider socioeconomic factors around location, around evictions, around property maintenance, around liens, around accidents, around income or bankruptcies or loss of assets can be a valuable source and tool to begin to be able to say what is the health risk score based upon the things going on in a lifestyle. So within healthcare, we take it seriously that we begin to say, how do we help health plans understand their members before claims begin to hit, before a catastrophic event begins to hit? And so we have worked diligently at LexisNexis Risk Solutions to predict health outcomes using these socioeconomic attributes when you have no claims data to rely upon. We also focus on taking socioeconomic health attributes and derive measures that can be able to then forecast out and create a member-level score around risk. The ability to really create a linear time frame and predict next year's health status at an individual level is critical in terms of making absolutely sure that the health plan's engagement programs and methods of emphasizing the importance of adherence to physician directives can be followed. And the ability then to predict the potential health risk over the next 12 months for new members and members who do not utilize the health care benefits necessarily as frequently as you would expect. It's been critical in terms of the way we can help guide the industry. Now, these are exciting times for our industry, and removing the handcuffs of having a membership population without any of the traditionally used claims history to fully anticipate health risks or opportunities for risk avoidance is exciting. But let's take a step back so you can get started. We've touched on many factors that emphasize that the time is right to establish a more thorough and robust approach to identity intelligence and insight. When your objective is to better understand your members' population and to impact engagement, adherence, accountability, and compliance, there are many arenas to consider when authenticating, validating, and managing identity information. Our approach is to build from Our approach is to build from identity resolution and verification to enhancing and augmenting member profiles, to understanding individuals and gaining insights to improve health outcomes, costs, and overall risk. Now, we recognize that augmenting internal data with identity data is a new discipline within the healthcare sector. But we're committed to this, and we're seeing validation more and more often. Just last week, we received notification that LexisNexis Risk Solutions is the recipient of the Frost & Sullivan 2016 North American Technology Innovation of the Year Award for Healthcare Identity and Management. Exciting times lay ahead. And with that, I'm going to hand it back to Cathy to take you through what we see as a logical way to get started with more of an individualized approach to your business. Cathy?
Great, thanks, Rick. I did want to touch briefly on the many market challenges that identity data and solutions can solve, and then we'll take a deeper dive, more segmented, to optimization and personalization of engagement. So some stats here, and since 2004, 620 million identities have been compromised. For me, that number is startling, but unfortunately, it's all too familiar. I have been one of these entities. A few years ago, when I was filing my taxes, I was alerted that they had already been filed, which was shocking to me because although I wasn't late, I was coming down to the wire, but I definitely had not filed my taxes. So my identity had been fully compromised, and after several months, which in reality was almost a year, my taxes were finally straightened out. Unfortunately, I continued after that fact to encounter additional difficulties as a result of my identity being compromised. There were some very expensive shoes in Spain, for example, being purchased with one of my debit cards. So I think we would all agree that protecting identity patient member data is critical. Another example of opportunities that understanding identities and information can assist is with the merging of, let's say, health plans, as the history and linking together of that data. To know that Cathy Sandell, that I had mentioned earlier in Michigan State, and Cathy Bardeen are actually one and the same helps to, sounds really easy, right? But it's not always that easy, and it really can help work towards managing these identities to avoid things like administrative delays or gross duplication when you're merging two different health plans together. And finally, up-to-date information and attributes on a member or patient allows for more personalized communications. Again, a real common theme that we've heard Rick touch on several times through the presentation today is really this movement towards more value-based payment models and how being able to more effectively connect with your member, your patients, and through that continuum will help the whole spectrum of delivery of healthcare. So identity management can facilitate the right message to the right person at the right time, which becomes more and more critical as we move through these ever-changing days in healthcare. So again, managing identity sounds simple, right? Well, as we've discussed, people are people and they're complex. And even the best laid plans change all the time. So what does that mean? The result is that the quality of data erodes and changes quickly. I live in South Florida, and it's sunny all the time. You can swim all year round. And I'm confident of the 45 million people who moved, about 20 million of them moved to Delray Beach, Florida. Or so it would seem, at least, during October to March. But in all seriousness, 21 million people change their jobs annually. There's 3 million marriages a year. And people have multiple, constantly in today's society, multiple phones, maybe a work phone, a personal phone, a home phone, and emails. I'm sure many of you have several different emails attached to yourself. So in reality, the core data that you may have, it's changing constantly, and it's critical to keep up to date to ensure that your team can stay committed and execute to that plan, right, to focus on more individual-centric solutions. When we talk about getting that right message to the right person at the right time, that is made more cloudy or more challenging as data erodes and people's lives take a different path. So I wanted to focus our discussion today around effective communication. And specifically around, as Rick emphasized, for success, it's critical, it's crucial to ensure we are striking the right balance between efficiency and effectiveness. So let's focus on the desired result to have a member that are more engaged in their health plan, in their health, and with their providers. How do we go about doing that? How do we kind of meet that objective and that desired result? I think it's important for us to look at our communication methods and policies and say, do we have an effective communication plan? We've seen some statistics that say 53% of marketers don't have the data to personalize content at all. This personalization, the ability to move away from a templated letter, allows us to really stand out among a crowd and make sure that that message is resonating. So when we take a look at the message and the way that we're communicating to a segment or population, we say, is the message age appropriate for, is the message appropriate for the member's family situation? I remember fondly the days when I was a dink. Dual income, no kids, right? More expendable income, had a lot more flexibility. This population or segment of a population is very different than what they now term a sitcom. Yes, this was a new one for me too. Single income, 2 children. But really the point here is that the message or call to action to these 2 different segments needs to be different. And it'll resonate more effectively if it's tailored and segmented to with that appropriate message. I think it's important to look at something like, is it age appropriate? The expectations not only in message, but also in format or channel is very different between populations. If we take a look at Generation Z, for example, they are football fields away from the baby boomers. A perfect example would be if I wanted to invite my niece over for dinner. She's in her early 20s. The only way I could get her attention, get a response, get her to let me know if she's attending dinner is if I sent her a text. A voicemail, she'd probably never listen to it and never get back to me. However, if I wanted to invite my mother over for dinner, if I was to text her, I'm confident she probably wouldn't speak to me for a week. She would find it grossly inappropriate that I was making that kind of invitation over a text message. So basically, age segmentation, changing the delivery method, the messaging, can all help improve the targeting of a population and really the response rate or the desired outcome. Also, I think it's important to take a look at, are we targeting the best audience? If you're looking to grow your footprint, for example, in a community, you're a provider, do you want to get a communication out to recent movers that have maybe just come into that community? A population segmentation that probably is less likely to have already made a choice or selected their providers. So again, all of this is really just to reiterate that basically leveraging an effective communication plan can drive not only the personalization of the message to get individuals more engaged, but also increase the likelihood to provoke that desired response in general. Communication optimization that we've been talking about is key, not only to engage these members, but because also the opposite can be very costly. The medical loss ratio mandates what can be spent on health by insurers. For example, every dollar in premiums for a group plan, only 15 cents can be spent on non-medical claims. With only such a small amount of dollars to spend, let's say on outreach, for example, or for adherence, it becomes more and more critical to augment that owned data to ensure that the message, the call to action, the request for adherence is well received and ultimately drives engagement. You want to make the most of what you spend and target, and that's critical by doing that with a very targeted and efficient messaging. It's essential. We've talked a lot about personalization and why that is so important, because I think that we would all agree it's very difficult to acquire new members. We are in a time where healthcare has shifted and members or patients are consumers. We keep hearing that term consumerism, and it's really critical to understand consumerism and what drives actions and decisions. Not unlike any brand like Coca-Cola or Pepsi, health plans today, for example, really need to focus on the reduction of attrition and how you can help reduce these overall costs. So really retaining your members, getting that message. You guys are going to get sick of hearing me say this, but the right message to the right person at the right time is critical in driving this capability. So I'll move a little bit more specifically into how Profile Booster works. Now this is just one solution. I know Rick had put up a continuum of identity management. This is one that sits in our identity management suite that is focused primarily on marketing. It was developed to help drive desired behavior from a targeted population. I spoke earlier about our data and the referential database of both individuals and businesses, but this is an example when we're now using this data to create analytics to augment insights on an individual. Again, the goal here would be to add data and insights on top of what is traditionally captured by, let's say, a health plan or provider organization, which will allow you to more easily improve accuracy, help drive down or maybe minimize those unnecessary costs, and ultimately, our desired target was to drive more engagement or improved engagement. Wouldn't it be fantastic to drop out of a campaign a segment that is of population that is less likely to respond or to convert or to adhere to the message you're sending? You would be able to use those dollars more efficiently and effectively and make sure you're driving the appropriate call to action to the appropriate individuals. All of this can be driven by understanding prior campaigns. So I know Rick had mentioned a great quote, "The definition of insanity is doing the same thing over and over and expecting a different outcome." That's really where the goal of profile boosters and the ability to augment analytics and insights is to change that. So it's a continual growth spectrum that allows for more targeted engagement and information. The goal of profile boosters is really to augment response models and boost conversion. So this is done by connecting the right data and linking it together. So as I create my envelope of information and understand aspects of Cathy Sandell, Cathy Bardeen, renting in Michigan, living now as a homeowner in Florida, all of that is very critical for me to be able to more effectively execute a model to get that right message to the appropriate person. Again, think versus sitcom here. That's really some of the driving components that can be augmented through the solution. I'm going to call out specifically and illustrate just a few examples of attributes that can be leveraged with profile boosters to give you guys a sense. I've talked a lot about data, talked a lot about information, but just wanted to kind of give you a sense as we segment our data and attributes into a couple key different areas. We partition it into groups, for example, like residential insights. Residential insights has a ton of different attributes in it, and it can vary from anything from understanding if a member in your population has central air in their home to something which I would guess might be a little bit more insightful of an attribute for this audience would be the average income of a neighborhood, and if that individual that you're reaching out to is moving in one direction or the other, meaning moving from a neighborhood with a higher income to a lower income average, or vice versa. So are they moving on up or potentially encountering more life stress events and moving from a socioeconomic neighborhood to a lower socioeconomic neighborhood? All of this, again, just is an example of attributes that can help tailor that message and optimize that delivery so we can move away from, again, more blanketed communications to something that's more targeted. As I mentioned earlier, data changes often and rapidly. So an example of our verification attributes is really just giving you that insight as data changes. If the information you're holding is the right information, do I have the right address, the right phone number, the right email for Cathy? And then finally, an example of our life event attributes is really anything around, let's say, an example would be address history and the ability or the attribute creation that would be able to say for Cathy Bardeen, let's calculate her address stability and the kind of insights that that may give you against a population. So for some people like my mother, who loves Michigan, has not moved in the last 20 years, and has absolutely no interest in moving to Florida, which I find shocking, but maybe lucky at the same time, her address stability would be calculated very differently than, again, my niece, early 20s, still finding her way, and she's moving minimum once a year, if not more. So all of these kind of attributes, this one specifically under life events, really all ties together, again, to let us help gain a better understanding and information specifically about an individual, to where they are in their life right now and that adventure, to help us gain insights and better communication in the future. So my last few comments is really just to paint a quick picture for you guys as to how this kind of identity solution can help charge with this with your delivery and your capabilities and customize and optimize those outreach programs in any type of example. So LexisNexis attributes are created at points in time. This is a key functionality because it allows our intelligence of the data to be applied retroactively on a prior campaign. So remember I mentioned earlier, wouldn't it be fantastic to drop out individuals who are less likely to convert, to accept that call to action, to maybe sign up for a new dental plan, to know that in advance and then deliver those rare dollars to the appropriate population. This is a perfect example of how we can do that. So let's say in January of 2016, there was an outreach program, again, for an upsell for a dental campaign, for example. With the results of that information, LexisNexis has the ability to run attributes on that population that as they looked in January of 2016. That modeled with the outcome information several months later, I'm going to say we're pretty much in November, allows us to understand and identify which attributes are important that we're driving that response. We're driving that targeted action and provoked a response that we're looking for. And then leveraging that together is where we shift to the future and we really execute that model on future prospects. Now again, data is changing, populations are changing, and information is always changing. So this is an ongoing process to continue to optimize. We're not going to stay in that path of doing the same thing expecting different results. No insanity here. It's a constant evolution to, again, optimize, personalize, and ensure you're reaching that target market effectively. So with that, I'm going to turn it back to Rick to take us through a few more comments and information.
Thanks, Cathy. You know, while somewhat dated, Atul made an observation I think is worth pointing out again. As he stated, economists have often pointed out that we paid doctors for quantity, not quality. And I would also add that that is changing. And he continues to say, as they point out less often, is we also pay them as individuals rather than as members of a team working together for their patients. Both practices have made for some serious problems. Well, let me just suggest that the individuality is also individuality of relationships. Without a plan's capacity to identify these relationships and how to relate and communicate with them, collaboration may well fail. So, how can we break the insanity conundrum? By enabling new results via doing things differently. It's a matter of enabling the health system through innovation and change by keeping the patient, the member, the provider, and every player and in every relationship at the center of the lens. Our own Identity Intelligence Suite has taught us that this laser focus can do many, many things. It can ensure repeated validation of all descriptive member identity data. It can ensure a unique and personalized engagement approach for every member's family unit. Maximize returns on communication and marketing efforts. It can secure accurate demographic profiles of membership. Better target individuals by utilizing attributes designed to provoke response. Cathy and I appreciate your time and attention, and we very much look forward to discussions with you as you begin to make patient-centric more than a phrase, but a business best practice, a business differentiator, and a window into new opportunities to lead. Thank you. I believe we have some time set aside for questions, but in the meantime, our contact information is on the screen, and we are always available to have a conversation with you.
Thanks, Rick. This is Cathy. I just wanted to remind everyone the capability to submit questions is to enter into the chat, which is in the lower left-hand corner, and then hit send. And that will allow Rick and myself to address any questions you guys have. All right, Rick, it says, I've got a question. It says, I agree with the importance of individualized views of our members, but how does Profile Booster differ from what you called social determinants of health?
That's a great question. And in fact, and sometimes the complexity of using non-owned data can be confusing. Think of it this way. When Cathy was explaining Profile Booster, she was talking about the vast variety of economic data that is out there on all of us and how that data can help to create a better picture about where we are, where we're located, frequency of moves. Well, likewise, that same economic data can also be converted using clinical validation to individualized level of risk factors to be able to identify those individuals who are going through significant life changes, such that those life changes and those changes that the socioeconomic data surfaces actually surfaces as a risk to their own health score. And so certainly there is a healthcare modeling capability that our clinical team uses to create these additional views for clinicians to look within the health plan to look at those people that may need immediate attention. But also the socioeconomic capabilities further enhance creating a view for the members.
Great, thanks, Rick. Next question is, why do you think healthcare hasn't embraced identity management like other industries, for example, retail or banking?
Well, I'll take a stab at that. I think it's not so much that embrace. I think it's we've just lived in a different world. I know for a fact that when I worked within healthcare and worked within the health plan, we were so focused on trying to complete the operational processes, we oftentimes didn't think of us in a different view. I think also that with the age of consumerism, health plans are becoming more and more cognizant of that while the primary payer of the bulk of the book of business may be coming through an employer group book of business, the individual employees within that employer group are taking on more of a partnership role within their employer. As a partner, we're also seeing that more and more members are acting like true consumers. And so the retail industry, the banking industry, which had long since reacted to the clamor for more information, more personalized experiences. So when I log on, let's say to LL Bean, I'm expecting certain views, where Cathy, you log on, you're expecting different views. Now in healthcare, that same kind of differentiation is becoming important. Important because consumers are expecting that kind of information to make informed decisions. So as we create these individualized views, it also creates for an additional opportunity to help our care management programs to have a better view, a deeper view of members long before claims begin to pour in.
Great, thanks, Rick. I've got another question. What outcomes have you observed via the use of your data?
I think that's a great question from a standpoint. I think oftentimes outcomes get convoluted with cost avoidance. The ability to react to a member's profile in a different way beyond just their identification number and their location and whatever block of business or group they're covered in. The ability to understand more about an individual also affords the ability to intercede quicker, more aggressively in terms of making sure, for example, someone that may be going through stress indicators gets the attention they need before claims become overbearing. And so I think the better question, and this has always been the case within, even in the days when we first looked at disease management and began to try to identify which 20% of the business was driving 80% of the cost. I think the real challenge is to be able to identify those opportunities that the plans have leveraged to engage sooner rather than bear costs later. And so when you think about outcomes in terms of cost avoidance, that's a harder number to document, but certainly this is something that more and more of our plans are asking for more assistance with.
And Rick, I'll take that specifically maybe for some statistics around Profile Booster and some of the outcomes that we've seen, kind of shifting the angle or the take on that a little bit. I can speak at a high level at some of our performance testing that we've engaged with some current clients, two different areas. For models, we've seen some segmentation that's been able to improve an average or a standard KS scores around 35%, where we're coming in around 42.6% when we apply a Profile Booster model against a already run population. To say that differently, maybe if everyone's not as familiar with that scoring value, is for our top 10% of scored population that we would prioritize, let's say, as a targeted market to go after, we see a response rate of 50, about an average of 50 response rate or conversion rate, which is fantastic. compared to if you were to test or target to that entire population around an 18% response rate. So those are the kind of measures specific to Profile Booster where we leverage information to be able to see our performance and the value add of adding on top of known data this particular kind of attribute information to more better segment a targeted population and then monitor and manage the response rate. Okay. Next question. I know you work with health plans. Have you done any work with FQHCs? Big difference in data quality. I'm going to let you, Rick. I'm not. I don't know what an FQHC.
Yeah, we haven't been engaged directly into that arena from a standpoint of quality. When we get into big data, certainly LexisNexis is no stranger to big data in terms of leveraging that information, considering 35 years of data and the amount of line item data that we disclosed when Cathy talked about the vast array of assets.
Okay. Great. And we've kind of slowed down on our inbound questions. We'll give everyone one last chance, again, to submit any questions for Rick and I. And if not, I think we'll move towards wrapping up and giving you guys a few minutes back. Thank you so much for your time this afternoon and for joining us for this discussion.
Thank you both for that great presentation and for sharing your thoughts today. Thank you to the audience for participating in today's conference. That concludes this webinar. Thank you again, and enjoy the rest of your day.